Swollen cheek, causes and prevention. Swelling in one or both cheeks can happen for a number of reasons, from a minor facial injury to an infection or a more serious underlying health issue. In this video, we explore the causes and prevention of swollen cheeks. Areas of swelling. The area of swelling can help a doctor identify the problem. For example, an infection may cause swelling in only one cheek. Below, find more examples of causes of swelling according to the affected area. One cheek. Conditions that may lead to swelling in one cheek include a facial injury, a tooth abscess, salivary stones, an infection such as cellulitis, a salivary gland tumor. Inside the cheek. Swelling on the inner lining of the cheek may indicate lymphadenitis, the enlargement of a lymph node, usually due to infection, a tooth abscess, hypothyroidism, Cushing's syndrome, Sjogren's syndrome. Alongside swollen gums, cheek and gum swelling often indicates an infection of the gums or a teeth abscess. Pericoronitis, for example, is an infection that occurs around a tooth that has only partially broken through the gums, and it can lead to cheek swelling. Causes of cheek swelling. A wide range of issues can cause swelling in one or both cheeks, and some of these causes are more serious than others. For example, injury. An injury from a fall or blunt force, for example, can damage soft tissue and bones in the face, which can result in facial swelling and pain. Minor injuries often heal on their own, but anyone who suspects that an injury may be more severe should receive medical attention. Tooth abscess. Tooth decay is a common oral health condition that happens when acids break down the enamel coating of a teeth. Untreated decay can lead to infection around the root of the tooth. If the infection becomes more severe, a pocket of pus called an abscess may form, leading to swelling. Mumps. Mumps is a contagious viral infection of the salivary glands. Symptoms including swelling in the jaw and cheeks may appear 12 to 25 days after the initial infection. Other symptoms of mumps include a headache, a fever, fatigue, muscle aches or chills, a loss of appetite. Salivary stones. Salivary stones are calcium deposits that form in the salivary glands. Another name for this issue is sialolithiasis. Salivary stones most commonly affect people aged 30 to 60 and are more common in males. The exact cause of salivary stones remains unknown. However, they can form when bacteria and food particles enter the salivary glands. If a person does not receive treatment, a salivary stone can block a salivary duct and lead to an infection of an infected salivary gland can include swelling in one cheek, which may feel warm, sensitivity or pain in the area, difficulty or pain when chewing or speaking, foul tasting discharge from the infected gland, a fever. Lymphadenitis. Lymphadenitis occurs when one or more lymph nodes swell in response to an infection in the area. If the infection is in the head or neck, it may lead to swelling in one or both cheeks. Cellulitis. Cellulitis is a bacterial infection in the fat or soft tissue beneath the skin. Alongside facial swelling, other symptoms include skin that feels warm, pain or tenderness in the area, a fever, chills. Pericoronitis is inflammation of the gums around a tooth that has only partially emerged. Third molars or wisdom teeth are most commonly affected. Pericoronitis can sometimes cause intense pain. Hypothyroidism. Hypothyroidism refers to the thyroid gland not producing enough hormones to meet the body's demands. Weight gain and puffiness in the face are common symptoms of hypothyroidism. Other symptoms include fatigue, muscle and joint pain, sensitivity to cold temperatures, reduced sweating, heavy or irregular menstrual periods, constipation, a slow heart rate. Cushing's syndrome. Cushing's syndrome occurs when the adrenal glands produce too much cortisol. People with Cushing's syndrome may experience weight gain and puffiness in the face. Other symptoms include increased fat in or near the base of the neck, a fatty mass or hump between the shoulders, purple stretch marks on the abdomen, breasts, hips or underarms, muscle or bone weakness. Sjogren's syndrome. Sjogren's syndrome is a chronic autoimmune condition in which white blood cells attack the salivary and tear glands. People with Sjogren's syndrome may develop swollen salivary glands, which can make their cheeks appear puffy or swollen. Other symptoms of Sjogren's syndrome include excessive dryness of the mouth and nose, a chronic cough, vaginal dryness, dry, itchy or burning eyes, numbness or tingling in the hands and feet, fatigue, blurry vision, difficulty swallowing or speaking. Cheek swelling in children. In a child, cheek swelling may result from lymphadenitis, cellulitis, Cushing's syndrome, hypothyroidism, facial injury. Diagnosis. If a doctor cannot identify the cause of the swelling with a physical exam, they may recommend one or more of the following tests: CT, MRI or X-ray imaging tests to evaluate the extent of swelling and identify structural abnormalities, blood test to look for signs of an infection or thyroid problems, urinalysis to check for systemic infections and kidney problems, biopsy to check for cancerous cells in the mouth or throat. Prevention. In some cases, cheek swelling results from poor dental hygiene, which can lead to an infection. It is crucial to brush the teeth twice a day and follow all other dental hygiene recommendations. If an infection seems to be healing slowly, it is important to consult the doctor or dentist. The sooner the person receives care, the better. When to see a doctor. A person should receive immediate medical attention if sudden cheek swelling accompanies swelling of the face, lips or tongue, a skin rash, hives, difficulty breathing or swallowing, dizziness,